can Botox actually be preventative? And I say this more so because you see like younger people, like 20-year-olds thinking that they need to start doing Botox, maybe baby Botox, so that they prevent the lines in the future. What do you say to that?
So preventative for sure. So I always say there's no better line than the one you could prevent, right? The one that you're never going to get. Yeah. So if we're starting earlier on, it makes a lot of sense. However, you can't take anything to an extreme. I don't expect an 18 or 20-year-old to start doing Botox unless you make a very strong expression with your glabellar lines, your angry 11s. And we could already see that even when that person is at rest, not making the expression, you could start see these subtle lines that even stay. And I always say that will be your actual cue. Maybe it's time for me to start considering toxin, regardless of your age and everybody's genetics, skin thickness. Some lines may show sooner than others. So that's why there's so much variability. And at what age? I don't like to define it so much by a number, but it's totally preventative overall, in the population. The earlier you start, I probably started in my late 20s, 28, 29. So the earlier you start, the less lines of expression you're going to have later on, when you're in your late 40s, 50s, and obviously 60s. So.
But one thing I do like to point out to people is, yes, preventative, but when you're 50, you're not going to suddenly be like, you know what, I don't need to do Botox anymore, right?
Yeah, so I get that all the time. Patients that come in with already all these lines of expression that even without them making that expression, that you could already see the places where they make expressions because you see all these lines that are etched into the skin. So I could already, it's a roadmap. I could see what the expressions are and which ones are the dominant expressions for them. And sometimes they expect to have the same result as maybe that 25-year-old that's doing it for prevention. Why didn't my lines magically disappear when I'm doing Botox? So I that's where education comes in. So for us providers, we have to sit with the patient and explain to them, your result cannot be expected to be the same as for someone that's doing it for pure preventative reasons.
Right.
So I always say, stretch out your skin. If you have a line there, if that line doesn't fully disappear, even when you're stretching out your skin with your fingers, then that means probably Botox is not going to be able to achieve that.
Yeah. Oh, that makes sense, actually. Yeah. So it's having realistic ideas of what any cosmetic treatment can do.
Absolutely.
Right. That makes sense. But back to the preventative, when people think that they're doing it for preventative measures, that doesn't mean that it doesn't mean that they're preventing them from doing Botox later in their life, right? Like that, they're still going to probably have to keep doing it.
Absolutely. So this is something you're going to have to continue to maintain.
Yeah.
So most of these toxins will last 3 to 4 months.
Yeah.
So the muscle is not going to you're not going to need it any less just because you started earlier.
Yeah.
And actually you're going to get used to that look. Yeah. So that's what I tell every patient, including myself. If I do Botox 2 weeks later, I'm going to look great. I'm going to get used to that look. I'm going to look refreshed.
Yeah.
And 3 months later, you betcha, I'm going to want to look exactly the same.
Yeah.
And I'm going to keep on going for that treatment. So it's like if you do your hair, you dye your hair, you're going to see your roots grow. You may want to go back to that, right? So it does require maintenance. Exercise is no exception.
Yeah.
You get toned, you got to continue working out to maintain those results.
It's probably something to consider if you're like 20 and you're like, I'm going to start doing preventative Botox. That means you're doing Botox since you're 20.
That's a very good point.
Yeah.
Yes, for sure. So you're going to have to continue doing it.
Well, that leads to another viewer question, and one that I've actually talked about too, and that is resistance to the neuromodulators. And when does that start happening? Is it a chance that you're taking if you're starting younger? Is there a possibility that you're going to need more and more as you get older, or you might even become resistant to it?
So yeah, this question is very complex, and I think still a lot of answers that we do not have, and we need more studies to look into this immunogenicity and this issue of resistance that has been coming up. We saw a lot of cases or people talking about it more after COVID, but the reality is it can happen with any immune response. And we don't know why you may have that immune response secondary to any virus your body is exposed to. But it could happen with a vaccine. You could get a vaccine and you could have a very strong immune response to that. And then those antibodies can sort of recognize mimicry. And if you're exposed to the toxin around that time when there was a peak immune response, the theory is that then now the molecular mimicry is going to make that antibody go after that toxin and neutralize it. So you won't have an effect.
Wow.
So timing is also crucial here.
Yeah.
When is that immune response peaking? creating all those antibodies, because maybe the timing was perfectly right. So maybe it wasn't peaking. And that's why, even though you were exposed to COVID and so was I didn't get that response. So it's a very individual response. Everybody has a different immune response, even though we could all be exposed to the same agent or pathogen. But it could also be the timing at which the toxin was exposed.
Yeah.
After you were exposed or you were having that immune response from that other entity.
So then could you maybe just take a break from using that brand of toxin and then try it again later?
And that's what we try as providers to tell patients, let's go ahead and go with longer breaks, which also takes me to another answer to your question. When patients try to do their toxin way too close of an interval, so not respecting that 90-day window minimum, that could also put you at higher risk.
Really?
Correct. Yeah. So
this is like taking your antibiotics. Like when your doctor's like, you're like, I'm sick, give me my antibiotics. And they're like, nope, you were already on a round, or you need to finish off this round.
Exactly. So if you're going too close of an interval, instead of at least waiting the 3 to 4 months, that could also put you at risk for that kind of resistance. Also doing very high doses. So that was looked into as well. Just like a low dose may make it wear off quicker.
Yep.
Doing a very high dose because you want to be totally paralyzed could also put you at risk for a higher immune response. So there has to be more studies that really study all these variables.
Yeah.
Very hard to isolate them because, we're humans and we're exposed to so many things at once. So that's why the studies are very complicated.
Yeah.
And to do proper randomized controlled trials and look at all of this. But I think with more cases coming up of resistance, more studies should definitely be coming up.
So you're starting to see more resistance amongst your patients?
Absolutely, yes. And patients that stop responding. So a lot of the currently FDA-approved toxins are all the same type toxin A. So
meaning that they're targeting like a specific protein? Is this what I heard?
So these are all produced. This is a purified protein type A.
Okay.
And all the ones that we use for in the aesthetics world, all the brands have the same active ingredient. Their differences come in with the accessory proteins, the carrier proteins, and other things that just subtleties here and there. But the active ingredient is the same.
In all the brands?
In all the brands.
The ones that you mentioned? Okay.
Correct.
That's good to know.
Even though their formulas are slightly different. I'm not saying that they are. But now what they've seen in some patients that are resistant to all of those in the aesthetic world, sometimes they've tried the other purified, the type B.
Okay.
Which is a different type of tox.
And what would that
some
brand
patients can respond.
So you're saying there is a type B. Is this something I should be looking at? What is it?
Yeah. So what some of my patients tried when they stopped responding to all the brands that are approved here for aesthetic use, some of these people tried the type B, which is only used for medical use.
Oh, okay.
MyoBlock.
That's the brand.
That's a brand.
MyoBlock. Okay.
So then they saw a response with that. However, I'll tell you, a patient of mine actually tried MyoBlock. I didn't do her MyoBlock, but she had another provider do MyoBlock before she came to me. She had a good response at 2 weeks. A month later, none. Gone. Even MyoBlock.
Wow.
So there's cases that we still can't explain to just stop responding completely.
Are you seeing like an age range or like anything, or there's just so many different factors and you can't even like narrow it down?
I can't even narrow it down because I have seen it in 60-year-olds and I have seen it a lot in that 30 to 40 something year olds.
Yeah.
Which I would tell you most of my patients have been in that late 30s, 30s to 40s. Yes.
Yeah.